Vaginal discharge is a normal and healthy part of being a woman. It's something that every woman experiences, and it's a sign that your body is functioning as it should. It's your body's way of cleaning and protecting the vagina. This natural process helps to maintain the delicate balance of the vaginal ecosystem, ensuring that harmful bacteria and old cells are removed. The vagina is a delicate ecosystem, and discharge helps to keep it clean and free from infection. Just like any other part of your body, the vagina needs to be kept in a healthy state, and discharge plays a crucial role in this. Think of it like a self-cleaning oven, but for your body. Just as a self-cleaning oven removes grime and buildup, vaginal discharge helps to clear out unwanted substances, keeping your reproductive system in optimal condition. Discharge is made up of fluids naturally produced by the vagina and cervix. These fluids are essential for maintaining the health of the vaginal tissues and for providing a barrier against infections. This fluid carries away old cells and bacteria, keeping the vagina healthy. By doing so, it helps to prevent infections and other health issues that could arise if these substances were allowed to accumulate. It's perfectly normal to have some discharge every day. In fact, the presence of discharge is a sign that your body is working to keep your vagina clean and healthy. In fact, most women do. It's a common experience shared by women of all ages and backgrounds, and it's nothing to be embarrassed about. The amount and type of discharge can vary from woman to woman. Some women may have more discharge than others, and the consistency and color can also differ. It can also change throughout your menstrual cycle. Hormonal fluctuations during different phases of the cycle can influence the amount and type of discharge you experience. This is due to fluctuating hormone levels, which influence the amount and consistency of the discharge. For example, you might notice more discharge around ovulation when hormone levels are higher. Don't be alarmed by these natural variations. They are a normal part of your body's functioning, and are usually nothing to worry about. They are simply a sign of your body's natural rhythms. Embracing these changes can help you feel more in tune with your body and its needs. Embrace your body's wisdom and understand that discharge is a positive sign of a healthy vagina. By recognizing and appreciating this natural process, you can feel more confident and empowered in your own body. Just like the weather, which can shift from sunny to stormy in a matter of hours, vaginal discharge can be unpredictable and may leave you feeling puzzled or concerned. Its texture, color, and even smell can change throughout your cycle, reflecting the complex interplay of hormones and bodily processes. These changes are usually nothing to worry about, and are simply a reflection of your body's internal environment, adapting to various phases of your menstrual cycle. The consistency of discharge can range from thin and watery to thick and sticky, each type serving a different purpose in maintaining vaginal health. It can be clear, white, or even slightly yellowish, and these variations are influenced by factors such as diet, stress, and overall health. These variations are all considered normal and are influenced by factors like ovulation, menstruation, and sexual activity. For instance, during ovulation, the body produces more estrogen, which can lead to an increase in discharge. Before your period, you might notice a thicker white discharge. This is due to the rise in progesterone levels, which prepares the body for potential pregnancy. This is completely normal and is just your body's way of preparing for menstruation. It's a sign that your reproductive system is functioning as it should. After your period, the discharge might be lighter and less noticeable. This is because the hormone levels drop, leading to a decrease in discharge production. Ovulation can also bring about changes in discharge. During this time, the body is at its most fertile, and the discharge becomes more prominent. Around the time of ovulation, you might notice a clear, stretchy discharge, similar to egg whites. This type of discharge helps sperm travel more easily through the cervix, increasing the chances of conception. This type of discharge is fertile and indicates that you are most likely to conceive. It's a natural way for the body to signal that it's ready for reproduction. Hormonal changes, like those experienced during pregnancy or menopause, can also impact discharge. These changes can be more pronounced and may require adjustments in personal care routines. Pregnancy often leads to an increase in discharge, which helps protect the uterus from infections and keeps the vaginal area clean, while menopause can cause it to decrease. This is due to the decline in estrogen levels, which can lead to vaginal dryness and discomfort. Staying hydrated and maintaining a balanced diet can help manage these changes. Drinking plenty of water and eating a variety of fruits and vegetables can support overall vaginal health. Regular exercise and stress management techniques, such as yoga and meditation, can also play a role in maintaining a healthy balance of discharge. If you ever notice a sudden change in your discharge that is accompanied by itching, burning, or an unusual odor, it's important to consult a healthcare provider. These could be signs of an infection or other medical condition that requires attention. Understanding the normal variations in vaginal discharge can help you feel more confident and in tune with your body. Keeping a journal of your cycle and any changes you notice can be a helpful way to track your health. Remember, you're not alone. Many women experience these changes, and talking to friends or joining a support group can provide reassurance and valuable insights. Educating yourself about your body and its natural processes is empowering. There are many resources available, from books to online articles, that can provide you with the information you need to understand and manage your vaginal health. Embrace the changes and trust that your body knows what it's doing. With the right knowledge and care, you can navigate the ever-changing landscape of discharge with confidence and ease. While variations in discharge are normal, certain colors can signal a potential problem. Understanding these colors and what they mean can help you take better care of your health. It's important to pay attention to your body and seek medical advice if you notice anything unusual. Early detection and treatment can prevent more serious health issues. Remember, it's always better to err on the side of caution when it comes to your health. Regular checkups and open communication with your healthcare provider are key, clear or white. This is considered normal and healthy discharge. It plays a crucial role in keeping the vagina clean and free from infections. It may be thin and watery or thick and sticky, depending on where you are in your cycle. Hormonal changes throughout the month can affect the consistency and amount of discharge. Yellow or green. A yellow or green discharge, especially if it's thick, chunky, or has a foul smell, could be a sign of an infection. This might include bacterial infections or sexually transmitted infections, STIs. This requires a visit to your healthcare provider. Prompt treatment can prevent complications and ensure your reproductive health is maintained. Gray discharge, often accompanied by a fishy odor, could be a symptom of bacterial vaginosis. This condition is caused by an imbalance of the natural bacteria in the vagina. This is a common bacterial imbalance in the vagina. It's important to get it treated to avoid further complications, such as an increased risk of STIs. Brown discharge can be normal, especially if it occurs right after your period. This is usually old blood leaving the body, which can appear brown rather than red. However, it could also be a sign of old blood, or in rare cases, cervical cancer. It's important to monitor the duration and frequency of brown discharge. If you experience persistent brown discharge, consult your doctor. Early detection of any potential issues can lead to more effective treatment. Pink discharge is usually a sign of blood. It can occur for various reasons, including minor vaginal irritation or hormonal changes. It could be related to your period, ovulation, or even implantation bleeding in early pregnancy. Tracking your menstrual cycle can help you understand the cause of pink discharge. However, if you experience heavy or prolonged pink discharge, seek medical advice. This could indicate a more serious condition that needs prompt attention. Understanding the different colors of discharge and their meanings can empower you to take control of your reproductive health. Don't hesitate to reach out to a healthcare professional if you have any concerns. Regular monitoring and open communication with your healthcare provider can help you maintain a healthy and balanced life. Always prioritize your well-being and stay informed about your body. Several infections can affect the vagina, leading to changes in discharge. These infections are common and treatable, but it's essential to seek medical attention for proper diagnosis and treatment. These are caused by an overgrowth of yeast in the vagina. Symptoms include thick, white, cottage cheese-like discharge, itching, burning, and redness. BV is caused by an imbalance of bacteria in the vagina. Symptoms include a thin, grayish discharge with a fishy odor, itching, and burning. This is a sexually transmitted infection, STI, caused by a parasite. Symptoms include a yellow or green discharge, foul odor, itching, and pain during urination. These are STIs that can cause abnormal discharge, pain during urination, and pelvic pain. However, some women may not experience any symptoms. While infections are a common cause of discharge changes, other factors can also play a role. These include, as mentioned earlier, hormonal fluctuations during your menstrual cycle, pregnancy, or menopause can affect discharge. Just like any other part of your body, your vagina can also experience allergic reactions. Irritants like soaps, detergents, or even condoms can cause irritation and changes in discharge. Leaving a tampon in for too long or accidentally inserting a foreign object into the vagina can cause irritation and abnormal discharge. These are non-cancerous growths that can develop in the cervix or uterus. They can cause bleeding or spotting between periods and changes in discharge.